Hello, hello.
What's happening?
Happy Friday. Happy Friday.
Friday.
How was your week?
Uh, Crazy.
I talked to some of your patients. They was doing good. They was happy. You know, I'm the
I'm
surgery
glad.
sister. I'm
I'm
the
glad. I'm
surgery
glad they
sister.
help. I'm glad they happy. As long as they happy, I guess that's all that matters.
Right. Yeah. Told you I'm the certified surgery sister.
You the go-to.
All right.
Uh,
Well, we'll let the numbers climb before we get started. You should pin your information at the bottom.
yep.
Welcome, everyone. We're letting the numbers climb. Good afternoon. Good evening, good morning, depending on your time zone.
Here we
All
go.
right, so I am Cola Red Bell. If this is your first time here, we are joined with Dr. Johnson. Um, I am one of his many patients that he has treated for fibroids. And yes, I still have questions from last session. I have submitted questions that came in since our last session. And then we also, if you have a question tonight, please put your question in the question mark with the bubble around it. And also, if you would like to join in person to get on the live and ask your questions yourself, you can get a free mini consult
Mhm.
on the spot to ask any questions that he may need additional information because every case is specific. So, without further ado, I'm going to kick it off with a submitted question. And this actually, since our last live, came to me a lot. So many people wanted to know since our last live, what about fibroids cause pain with sex? So I answered it for me personally, but from a doctor's perspective, you may have what other patients say. So for me personally, and anybody who wrote me, I responded. It wasn't during sexual intercourse that I was experiencing pain, but I would cramp really, really bad after. So I would have pain after the fact, and it was really, really bad, like almost like your period cramps times 20 or whatever. Like it was an intensified cramping that I would experience after the fact. So Dr. Johnson, they wanted to also ask from, well, they wanted to know what about the fibroids could cause pain with
Sure.
sex.
Typically, when fibroids cause pain with sex, they are um are low on the uterus. They're located very like on the bottom of the uterus, and they're typically right there at the top of the vagina, or actually pushing into the cat into the vagina space, to where like now with sexual intercourse, a penis is going to be bumping fibroid or bumping just the mass of the fibroid, and that's painful. I've had multiple patients where there's just impossible. I don't know how in the world they had sex, but they were able to have sex, and because the fibroid was like pushing so much into their vagina, it's like it was no place for the penis to really fit around it. But they were able to do it and manipulate to figure it out. But that's really more so like what it does. It's like it's just a hard mass that if it's located low, it's going to just cause like just a structural pain, because you're like literally hitting this hard mass that's in the vagina as opposed to just vaginal tissue. That's usually how fibroids are painful with sex, just from a location standpoint.
All right. And then one person to piggyback on that wanted to know, could a fibroid be covering your G spot to interfere with orgasms?
No, I mean, and you can't never say no definitively, I guess, but that's that would be rare. So your G spot is like 2 centimeters on the top part of your vagina behind your urethra. Like, so it's on the top wall. And so a fibroid would have to be really, really low and on the top part of the uterus and just pushing into the vagina so that it's obscuring that area of tissue where the G spot is at. So could it happen? Yes, it would be rare. It's not something that would happen very often. So, you know, I, you could say no, but yeah, I could see definitely it could impact someone, or there's someone out there in which, like, yeah, it's changed the vagina so much to where like just some of the erogenous zones are distorted because of the fibroid pushing to the cavity. But overall, no, it's not really gonna block the G spot. It can just kind of distort things a little bit.
All right. Question in the chat. I had Accessa in 2019 and UFE in 2022.
Jesus.
Because I've had Accessa procedure, I was told that I'm no longer a candidate for a myomectomy. Is that true?
It's not true, but I would say don't get nothing else. You can still get a myomectomy. I've done myomectomies on people and patients with that have had both, that have had UFEs, that have had Accessa, that have actually had both. So you can't get, you should not be getting Accessa after a UFE. You can get a UFE after Accessa, but in that vein, yeah, if you did have Accessa and then you had a UFE,
Yeah, they had
y-
it in that
yes,
order.
yes, you could get a myomectomy, but to that point, I would be like, what is your goal at this point? And if fertility is the answer, you want to have babies, then there needs to be some very, very concerted efforts in order to get pregnant. Nothing should be left to chance at this point. You should be seeking fertility consultation and moving forward with a very concise plan for fertility. Like, you shouldn't be like, oh well, maybe if God blesses me and a man come. No, you need to be in somebody's office, paying some money, getting some eggs, getting some embryos, going through IVF cycle. All of those things should be happening if you've been through all of that, and this is where you're at now.
All right. Is uterine fibroid embolization a good option?
No, it is not. I mean, if you want more specific, like I've talked about it extensively, like you can go back into the. I ain't gonna spend a whole bunch of time on that. If somebody hop on here and ask, then yeah, but it is just not cutting blood supply off to any living tissue is not, well, I won't say it's not a good option, but it's not a good option for everybody. It's very few people that I would say it makes sense for. And one of those people are like people that have multiple like medical issues and they can't undergo, a big surgery like a myomectomy or even Accessa. Like they have no other choices. They have been bleeding, they have major issues, and that is like a minimally invasive approach to try to control things. Those people would be candidates. Other candidates are like, in certain instances, like after delivery of children, like after a true life delivery, the uterus is bleeding or there's some hemorrhaging or what have you, and a patient is not a good candidate to go and do like a hysterectomy or go like do something major, because of other medical things that are happening. UFEs can be used, or not UFEs, but uterine artery embolizations, where you're just cutting off the blood vessels to the uterus. Um, those are that's another treatment or last resort for some of those patients. So it's particular instances in which it makes sense, but healthy women that are trying to get pregnant that are having issues with fibroids, I do not recommend it. I don't recommend it to my family. I don't recommend it to my patients. So I just wouldn't recommend it to somebody that does not even see me. I just don't recommend it. I don't believe in it at all. So I've taken care of people that have had UFEs and have done well. So I'm not saying that it's never successful. That no one is successful. I've seen success stories, but in my personal experience with UFEs, the overwhelming majority of people that I experience that have it are not happy. They're not satisfied. They're having issues, and I end up operating on them again anyway. So that's what I see. And I'm all about telling people, everything that I talk about is either from things that I've experienced or read or know for a fact. I don't talk about things that I'm not very sure about. And so if I look at my experience with patients with UFE, the experience is not good. The overwhelming majority of the people that I encounter with it have issues, are not happy with it. So therefore, I carry that on to my consultation with people. This experience is the best teacher. I have to tell you, I wouldn't recommend it.
All right. If you just joined us tonight and you have a question, please put it in the question mark with the bubble around it, like press that button to submit it so it goes into a screen that I can go back and forth. And then if you want to send a request to Dr. Johnson to join in person, you are more than welcome. Is anybody waiting to join before I go to the next question?
Nope.
All right.
It's a light night. I guess we don't like Friday evenings, but it is what it is. It'll be posted.
All right. Does intermittent fasting cause fibroid shrinkage?
No, absolutely not. Don't do it. If that's what you think that's what it's about to do, don't do it. There's not anybody that can come on here and then tell me like the true benefits of intermittent fasting. They're just not like, and I'll talk to anybody about it. Like if you talk to true nutritional experts or what have you, like and really break down you know what the anticipated benefits of intermittent fasting, it's definitely not proven. It's not clear. I don't recommend intermittent fasting to anyone. It doesn't make sense. I don't believe in it. You go ahead, you can fast all you want to.
When we talked about this at my doctor's visit, I do 12/8 and I love it
Why?
because I feel like it was definitely very instrumental in when I lost over 65 pounds. Now, do I probably have to keep doing it?
Now
Maybe
pause.
not.
Okay, let's stop. Back up. But hold on, don't glance over it. Okay, so that's a very important point. You said I feel like. That was one. All right, so I feel like means
Okay,
like giving
I
a feeling. Hold on,
definitely,
no, wait, I ain't finished yet. And then you
they
said past tense of I lost 65 pounds. So what happened to those 65 pounds?
I lost them.
And did they ever come back?
Oh, well, maybe
Oh.
10, maybe
Mm,
10. But
mm. So it's not sustainable, right? It's not a healthy lifestyle. It's not sustainable. So your body and your metabolism is geared so that there's a consistent fuel source, right? So even when you have like patients with diabetes or even when you're trying to lose weight, like your metabolism is really driven off consistent food sources, right? So if you think about why do camels have big humps on their back? You know?
to store their food.
Correct, because they don't know when the next time they're going to eat. Their body has no idea when next time you're going to eat, when next time you're going to drink. So they have these big reservoirs of energy and fat in stores because their metabolism is just so low because they don't know when the next time you're going to eat. So essentially, that's what you're doing. Your body is like, I don't know when the next time she gonna eat. We're gonna hold on to this stuff. We're gonna slow down. We ain't burning. We just gonna keep on like trucking along because you might not eat in another 4 or 5 hours. It's slowing your metabolism. So yeah, in the immediate is going to make you lose weight because you're at a caloric deficit. But when you come off of that and now you start eating regularly again, your metabolism is going to be super slow and you're actually going to have a rebound weight gain. You're going to have rebound issues unless you keep this intermittent fasting going for the next 20, 30, 40, 50 years, which most people can't do. And it's just not healthy when you just starve your body for significant periods of time. That's just not healthy. Your
Well, I
body
don't
needs
intermittent
you.
fast like that. I have a daily schedule that I eat on. So I eat starting at 12 o'clock and I stop eating at 8 p.m. Unless I have plans to go out and be outside or something, then I may switch it so I have an extra 2 hours in the evening.
Mm,
And then if I'm on vacation, I may eat breakfast.
Mm.
Well, I eat breakfast food. I just don't eat it at breakfast time.
So that's just saying it's not consistent.
No,
You just like,
I'm
hey,
not saying it's not consistent.
when I feel like breaking the intermittent fast, and I'll do it. But for the most part, I do it. The body don't work that way. It don't work on yo like, oh, I feel like that's what I'm gonna do.
Well,
It
that's what
don't
I'm
work
saying.
that.
Like, I still have to be reasonable. Like, I'm not gonna be on vacation and be like, "Oh, y'all go eat without me. I can't eat yet."
Hey, a diet is a diet. Your body ain't like on that trickery stuff. If you gonna be on the diet, you gotta be on the diet. You can't be like,
Well, I
oh,
still watch,
you know.
watch what I eat when I'm on vacation. But what I'm saying is that I may go to breakfast with the group and not wait until later.
So what I'm saying is there are no statistical benefits of this intermittent fasting thing that people talk. The way they came up with it, and I'm saying this because I'm with a nutritional expert. There was a bodybuilder, right? So who literally broke down like where intermittent fasting stuff came from. This was for bodybuilders, right? So that they can cut their weight significantly and then dehydrate themselves so they could be at this very peak dehydrated, muscle ripped state. That's where intermittent fasting came from. Some way, shape, or form, somebody was like, oh, they ripped. They could do that. Intermittent fasting works to get your body right, drop weight. No, that's not it. If you look at like why they do it and when they do it right before competition time, and just so to get the maximum results, and then they go right back to a regular diet, eating significant amounts to bulk and mass up. They only do it for very short periods of time to look a particular way. So if you're trying to say, "Hey, I'm doing this so I can lose this weight and look great," that's not it. But I'm just
I
saying,
still agree.
I'm just the
I agree
messenger.
with you
I'm the
100%
messenger.
about the calorie deficit thing. That's the most effective
Facts.
no matter what time you eat. I
But
agree
I
with that.
guarantee you, with your calorie deficit, it is much better for your metabolism and the longevity of your health, number one, your diet and sustainability if you have a caloric deficit that's sustained over a period of time. So instead of eating 1,600 calories and just say, hey, I'm going to have 1.5 meals for the entire day, and I'm gonna wake up, eat a big breakfast at 8 o'clock, and then I'm not gonna eat nothing else till 6 o'clock, and intermittent fast or that, and I'm gonna have 1,600 calories versus I'm gonna have 3 meals that have about 400 calories and then snacks of 150 to 200 calories in between and get to my 1,600. I guarantee you this person is going to be healthier. They're going to have a more sustained, more healthier weight loss, and they're going to look better at the end of the day. It's much healthier, it's more sustainable, and it looks 10 times better if you do it that way. Just a messenger. Everybody that want to fight me about intermittent fasting in there, I'm letting you know right now. We can fight all day. I know what the hell I'm talking about. What?
I
No,
didn't say you didn't.
I ain't
I
talking
said
about you.
that we gonna
I'm talking
agree to
about. I'm
disagree
just
on
talking
this
about.
one.
I know some people about to come in here. Like, hey,
I
I don't want
definitely
the intermittent
didn't
fast.
do it to
I
shrink
hear it.
fibroids though.
Huh?
I never did it to shrink
Well,
fibroids.
people.
Never did it for that.
No, I'm just saying. I just try to tell people like the truth behind because we do a lot of like, oh, I feel like people like I feel like if I rub this castor oil on here, like they say, it's just gonna seep on down, and the fibroids are just gonna start falling in the toilet. No, ma'am. Just because you feel like that's gonna happen, that is not how it works. But okay, you can rub, rub, rub. It ain't happening, but okay.
Okay, well I eat on a schedule. I'm gonna just say
That's fine. But I
that.
get if you plan out your
Yeah,
meals and have that caloric deficit over a significant period of time, I mean over the day, eat meal snack, meal snack, meal snack, healthy calories with with balance macros and micros, like all that stuff is balanced out in proportion to your weight, your body fat, all of those things. I guarantee you'll have better results and they'll be sustained much longer and you'll be healthier.
I agree. And summertime shy is the 10-pound reason. You know how it is the summer here. All
Hmm.
right, next question.
So somebody
Um,
want to hop on,
oh,
but we could do one more question and then we could let this person hop on.
okay. Um, I can't read. It says having laptop busted. So I don't know if they meant that something they typed incorrectly.
Hmm.
Yeah, I can't read this question. I gotta come back.
It's in a little question bubble.
Yeah, listen then obey. Can you submit your question again? Because I can't understand the other than I see
How
that
long
you put
can a person go without fibroids or
what's the one
having a
below it though?
having a laptop busted and want to keep ovaries? What would you suggest? I am 62. Um,
What do you think they was
it's
trying
like
to
having
say?
a hysterectomy. I don't know. She got to type that. Well, it sounds like she wanted a hysterectomy and wants to keep her ovaries, and she's healthy. Is she too old to do that, or what have you? And the answer, I
Oh,
guess,
okay.
is no. But we'll let her ask that. Um, let her ask that. Hello, how can I get the ball rolling to be seen? Seen how? You want to do virtual consultations are easy. They're right there. Like that's what I offer, people for that are not um available to like either fly in or drive in to come see me. If you're not and you are in Florida or California or wherever you are, just schedule a virtual consultation. If not, then you can DM me. I can give you my office information, and you can easily schedule an appointment to come to see me or hop on this live and let me know what's the problem. All right, let's
All
see.
right.
What else is this? She loves. I don't know if she gonna hop on here.
Oh, that's me, Dr. P.
Hi,
How y'all doing this evening?
we're
Dr.
phenomenal.
P, I've been on here for a couple of times.
Yes, ma'am.
How you doing, Cora?
I'm good. How are you?
I'm doing well. Dr.
Yes,
P,
ma'am.
I'm still having very small issues with my fibroids.
Okay.
Um, but it's not as bad as it used to be.
Okay.
And I remember you told me it was what I was eating instead of me just having the gut right here. But I
What was the problem? Refresh me, because it's been
remember
a while.
um I had asked you, was this my gut or was these my fibroids?
Okay.
And you had told me it was what I was cooking.
Okay.
Not exactly like that. That's not what
Right.
happened.
Right.
You was just
I'm gonna
saying
let her tell the story.
realistically
I'm
the
gonna let her tell
size
it.
look it'll take a big size to bulge you out. That's all you were saying. You was
Yeah.
like they have to be a
Oh
significant
no offense taken.
size.
I took it as a joke because I know I eat all day long, and it's like snacks and cookies and stuff. So I know that's a part of it, but I just want to know. So with me being 58, should I just let it be?
I mean, no, don't live in chronic pain and have issues. Like if it's really a point, and I would have to examine you to really get a better understanding of what's really happening with you. But I'm not a proponent of living in pain and having issues. If it's at a point where you are experiencing pain from this, and it is really the fibroids, then yeah, no, surgery is an option. I've operated in 58 and beyond. Women in their 60s, women in their 70s. Like so, it's not say to say, oh, just live with it for the rest of your life. I don't believe in that. I would just say just make sure that that's what it is. So a good exam, just really, because if fibroids are really what's causing you to have pain, it should be able to be reproduced on exam, meaning that I push up from the bottom and press down from the top. That same pain with the fibroid being squeezed like that should be reproduced. You should feel that again. And if that's the case and that's what it is, then yeah, why not? It needs to come out.
Okay.
Um, no different from a wisdom tooth or appendix or anything else that's causing you to have pain or issues or what have you. Yeah, absolutely take it out.
Okay. That that being said, that's good, and I understand. And now I'm just like in the middle of changing insurance
Yeah,
because I'm Medicare
got it.
and I don't have a secondary yet.
Gotcha.
And
So
so I'm
so
just
with that being said, you don't need to be cut open to do that. You should be able to that should be able to be removed minimally invasive, small incisions, laparoscopically out of the hospital in 1 to 2 and either same day or the next day. Like it should be able to be done very minimalistic to help you with your recovery, pain, all of those things. So now, if somebody, like I said, so you go to somebody and say, "Oh no, you got to get cut hip to hip, or you got to get cut up and down." Say, absolutely not.
okay. I appreciate you taking the time to answer my question, and
Of
thank you
course.
again. And I enjoyed listening to each of your sessions, and great experience. And I always try to say positive stuff because I know you know what you're talking about, and you're there also, Cola, to assist. So anybody should take your knowledge and run with it.
We truly appreciate
We
that. Thank you
appreciate
very, very much,
Oh
and thank
yeah,
you
of
for
course.
tuning in, and thank you for following us. We appreciate it.
Yeah. So you have to let
Awesome.
me off this time.
All right, I'll let you off. And we'll talk to you soon. If you need something else, you let me know. Okay.
Yes, sir.
All
Thank
right.
you.
All right.
All right, have a
No
good
problem.
You
one.
too, Miss Cola.
All right,
So,
next submitted
so
question.
all right.
Oh,
So
I'm sorry.
we'll do like three more, and then we'll add this next one in.
Okay. Can a vertical incision from a hysterectomy cause a hernia?
Yes. Well, it can't cause a hernia. It can increase your risk for herniation, right? Now I'll explain why. So when you cut, and this is why I'm so against vertical incisions for anything. Like for general surgery, like sometimes they need to go in vertically. Like for instance, if you get a gunshot wound to the belly, like you can't do small incision. You got to get cut up vertically because they have to go in and they're really saving your life to do something, right? But even with general surgery, that's probably one of the only few times where we do it. Like all other general surgery procedures are typically done either robotically, laparoscopically now, or with smaller incisions, like everything from gallbladder to appendix to even colon resections, to even hernia repairs are done with a minimally invasive approach. So all disciplines are shying away from vertical incision, and gynecology should not be any different. But the reason why vertical incisions are problematic is this: there are multiple layers of there are multiple layers from your skin all the way to the inside of your belly. There are some very important layers, and I'll run you through them real quick. So you have the skin, which is the stuff that you see. And then everybody where it talks about liposuction and all that stuff. Liposuction is literally the fat that's underneath your skin. So you got skin and then you have fat. Like there's some layers of fat, and that's cosmetic stuff. That's the liposuction stuff. That's the stuff that you see. You squeeze your skin and you get that fat underneath your skin or whatever. That's just the two layers up underneath. Underneath all of that, there is a layer called fascia, right? So fascia is the layer of skin underneath the skin. So you got your skin and the fat, and then you got a layer of skin that keeps everything in, right? So all your intestines, your uterus, your appendix, your spleen, your liver, all of that stuff is really kept into a cavity by a skin layer called fascia, and then you have muscle under there too, or what have you. So it's fascia, muscle, and then a little bit of another little thin layer called peritoneum. And so peritoneum is like the last layer before you get inside of the belly, and you could think of that as like the paint in your house. So if you think about like your belly as like the house, right? So the skin would be like the chimney, the fat the fat will be like, you know, the insulation. Your drywall would be like the fascia. Your drywall and your like your boards or what have you, or the real structure of your house is your fascia. And then the peritoneum is like the paint. It's like literally like the paint in the house is keeping and everything or what have you. So when you cut vertically, right? Everything like when you cut vertically, you're anytime you breach something, as it heals, it's never going to get the same strength that it has before it was compromised in the first place, right? So even if it heals, the weakest, it's going to be weak there from the healing standpoint. So think about it like this. Every time you get up from a seated position, like you stand up like this, you sit down like this, every time you do it, just try it, you're using your belly muscles to do it. Like you're using your abdominal muscles to get up, using your abdominal muscles to sit down. Every time like you strain or what have you, you're doing this. Everything does this. The lines of your skin, they go like these. They called the Langerhans lines of your skin, right? They go this way. When you cut this way, you go against those lines. So every time you go, you're basically pulling those lines apart. So that's why when you see people with vertical incisions, it's always thick or it's like it heals like weird because it's thick. It's because you're putting so much stress and strain every time you get up and get down or what have you, and it makes it harder for the body to actually heal because it's compromised right there, right? So that's number one from a skin portion. That's why vertical incisions have a higher risk of dehiscence or coming apart, or they also have a higher risk of keloid because you're putting so much strain on them during the healing process all the time. The fascia, which is the layer of skin underneath the skin that holds everything in, also gets stressed every time you get up and move down or whatever. So it's like when you cut into it, you want to cut into it, and the reason why I go so low and that I keep it as small as I can because I want it there to be as little tension on that fascia when it heals as much as possible. So when people get up and they sit down, they can use their belly muscles, but the cut is going this way, so it's going along the lines of healing, so it's much easier to heal. Whereas if you cut up and down, you're continuously putting stress, strain on the skin as well as the fascia, and it causes a weakening. All a hernia is a weakening of fascia or muscle in underneath, and it's allowing the inside of the belly to protrude through that breach or that weakening. That's what it is. So when you have like a vertical incision or what have you, and you have a breach in the fascia, now the contents of the abdomen, the most particularly the bowel, can now protrude through that, and now it comes to the stuff that you can actually see, the fat in the skin. So when you get up to the skin and you see like this big bulge coming in on the skin like that, and it's a true hernia, that means that the skin underneath the skin, the fascia, has a breach in it, and now the bowel has started to protrude through the fascia. And so now when you press on the skin on the outside, you could press actual bowel as it pushes through like the skin and the fat. Now you can't really touch the bowel, but that's what's pushing from the inside. That part should never be pushing from the inside. It should always be staying on the inside underneath the fascia. When you breach the fascia, that's when stuff comes up. So yes, vertical incisions, to answer the original question, vertical incisions increase the risk of hernias. They increase the risk of dehiscence or that skin coming loose, and they also increase the risk of keloid scars and fibrotic tissue formation, just because of the healing, the way that the skin heals and the way that the tissue heals as you know, with that type of incision. So I hope that answered the question. That was a lot, but
No, it
that
was
that should
very
answer.
good information. All right, you said somebody was waiting to join before I go.
Yes, couple.
Okay, go
Let's see.
ahead.
Okay. Hello.
Hi there.
Hello.
Hello. How are you?
Good. I've been following you for about, I don't know, about a year now, so I'm
Awesome.
excited to talk to you.
Awesome.
I'm 47 years young, and I was diagnosed at first with fibroids when I was about 30, and also endometriosis.
Okay.
And I've had a couple of three laparoscopic surgeries for the endometriosis. I had ovarian cysts.
Okay.
And I had a polyp removed too from my uterus when I was doing some fertility
Okay.
treatments. But they always just like told me to ignore the fibroid. And after the fertility treatments and all the medications, the fibroids just went crazy. I feel like
Okay.
I'll when I come see you eventually, like when I'm able to make that happen, I feel like I'm going to be one of your crazy
Think so?
yeah,
Okay.
because I had an MRI about 3 years ago,
Mm-hmm.
and they like lost track of counting the number of fibroids at that time.
Got you. What's the largest one?
I don't remember the count. I was gonna go look up the MRI
All
report
right. Well,
on the side.
let me ask another question. When you press on your belly, do you feel hardness above your belly button?
Yeah, I feel like I feel a bunch of them, actually, from underneath my belly button and like one above my belly button. I
Like, is
remember
it?
the report said that my uterus was like the size of someone that was 3 months pregnant
That's
because
not
there
bad.
was fibroids inside and outside.
Yeah, that's not too bad. So numer numerousness, not numerousness, but an abundance of fibroids is not as bad. You could have 30 of them that are like 2 or 3 centimeters, and they're not a big deal. It's more so if it's like if you have a lot of them and they're great enough size to make your uterus huge to the point where it's past your belly button all the
Mm.
way up close to your diaphragm where you breathe, and that's where, like, hold up, but that's where you start to
Knew that jab coming.
have
Okay.
where you start to have issues. But the number doesn't so much alarm me. It's more so like the size and
Okay.
the location of them, which becomes a bigger problem when you talk about surgery.
So before I found your page, I had gone for a consult for a UFE.
Hmm.
And I know at that time they said that there was like two that were borderline too big for the UFE procedure. And then that's when I started like researching the UFE procedure more, and I come across your page and some articles, and I was like, I'm not willing to take that
Yeah.
risk. Like I didn't want to end up having to have an emergency hysterectomy. But my question is more this, like I'm 47, so like the local OBGYNs have just said, well, why don't you just get a hysterectomy? And I feel like I don't want to get a hysterectomy. I feel young for my age. I'm like very active. Like I just don't want to do that. But like my periods take me out for like I'm down and out. So like,
Where
do you feel
where you located?
I'm in Arizona, but I have family in Illinois. I lived in
Sure.
Chicago for
Oh no, I literally have a patient right now. It's always crazy when I have these conversations. It's literally a patient. There's a patient right now that I operated on Wednesday. Wednesday, today's Friday. That just had a myomectomy. That's from Arizona. That she's here right now as we
okay.
speak. Um, but to that point, I would ask you this, like I ask every other consultation that I have. What is your goal? What do you want? What is your optimal goal?
I think my goal would be like to reduce the pain and the crazy
Got
periods,
you.
and also, like I don't want to have like my stomach look the way that it does, because like you can see and feel.
So great answer. So I didn't even have to go into that because usually when I ask people what their goal is, they're like, I just want these fibroids gone. That is not a goal. It's not. That's just a desire. Two
Mhm.
goals. Anytime we talk about fibroid surgeries are dealing with fibroids. Number one, I want to have a baby more than anything in the world. I will run through a brick wall. I will pay 30, 40, $50,000. I will get a surrogate. I'll get donor eggs. I'll get donor sperm. Whatever it takes. This is what I want. That's goal
Mhm.
number one. Goal number two, I want to be done with this. I'm tired of the periods. I'm tired of the pain. I'm tired of the bloating. I'm tired of the fibroids. I'm tired of everything. It is ruining my life. I need this to stop. That's goal number two.
Mhm.
They are mutually exclusive. There's a little bit of overlap, but not much. One of them has to be more important. If the most important situation is, hey, I want to have a baby more than anything in life, then we talk about what it looks like to preserve your uterus and to deal with your fibroids and those things. But if the number one goal is, I want to be done with this stuff for good, you have to put hysterectomy at least as an option. It has to be an option because of this, right? Fibroid surgery is, well, let me back up. The only physiologic reason you have a uterus in your body is to procreate. It's to have babies. It's for babies to get put in there and for you to have them as an incubator. That's it. It's not to make a woman feel more of a woman, to keep you clean. None of that stuff is factual. Everything is just to get pregnant. The entire life of a uterus, that's what it's doing. It's building up the lining, waiting for pregnancy to happen. Pregnancy doesn't happen, hormones are reduced, and then it sloughs off that lining every single month. That's what a period, that's what a menstrual cycle is. That's what it's doing. Waiting to get pregnant, pregnancy doesn't happen, slough off. Does that for 30, 40 years, right? In some people. If you don't have fibroids and you don't have issues with your uterus, it stops doing that process. It's no issue. You keep it going to menopause, you go on into the rest of your years with your uterus. No questions, no issues. However, if that uterus is giving you major problems, major pain, major bleeding, whether it be from fibroids or anything else, then you have to start talking about or strongly consider doing things to address that particular problem. Now, what people don't talk about, let me give you the true behind the curtain understanding about what fibroids do, what fibroids don't do, and what to expect from fibroid surgery. When people have abnormal bleeding or heavy periods or bleeding, it is always assumed it is because of the fibroids. Every doctor, having bleeding, fibroids are the problem. Having bleeding, fibroids are the problem. Where in a majority of cases, not the minority, but in a majority of cases, when women start to have significantly heavy periods or abnormal bleeding in their later years of life, not life, but later years of reproduction, late 40s, mid 40s, early 40s, when you just now all of a sudden are starting to get heavier and heavier periods, most of the time it has absolutely nothing to do with your fibroids. It has everything to do with your ovaries doing this. Every woman, it is not a knock on you or Cola or anybody. Every single woman from the time you started to have your menstrual cycles is a fact. Your ovaries start doing this. My 17-year-old child right now, her ovaries are doing this, right? My mom, ovaries are there, right? Everybody, right? It's going to happen. It's got to happen. Whether it's your mid 30s, late 30s, early 40s, mid 40s, late 50s, I mean early 50s, it's either happening or it's happened. We know for certain that by your mid 40s, it is most definitely doing this 100%. Most of the time, when women start doing this with their ovaries, what happens is that your periods now, instead of every month, now they're every 2 months or every 3 months, and they start spacing out and they start spacing out and they start spacing out, and to the point where you just stop having them and then you don't have them anymore. And that's what menopause is. That's what happens. In a minority of women, what'll happen is that they don't do that. Your ovaries start to your ovaries are not ovulating anymore. Your body's confused. That cyclical build up, breakdown is not. What do we do? Are we building up? Is she going to ovulate? Are we trying to get pregnant? Has no idea what's happening. And so you start to bleed irregularly and start to bleed super heavy. With that being said, I could treat your fibroids. I could zap your fibroids. I could remove your fibroids. I could do whatever you want me to do to your fibroids. This physiologic process is not changing. So the worst thing that you could do in the world is to come up to Chicago, sit on my table, have me sit up there for 4, 5, 6 hours, pulling out all your fibroids, repair your uterus, put it back inside of you, go through recovery, do all of those things or what have you, and then look up in 4 months and you still having heavy periods. We have accomplished nothing. And we definitely didn't accomplish the goal that you came up here to do, is to fix your bleeding, right? So to that point, I'm not saying, hey, don't push hysterectomy on anybody. I just make it so that you understand the choices and the decisions that you're making. So for any woman that I perform a myomectomy on, my strongest recommendation, and then very soon is going to be my mandatory recommendation, is that you either have a very viable pathway to getting pregnant, or have a very viable plan in which you're going to utilize in order to get pregnant after we go through all of these steps to save your uterus. If that's not the case, myomectomy should be off the table. We should be looking at not just hysterectomy, but there are other options to treat your bleeding. If those fibroids are not pushing into the cavity, you have medications that can help you, that could bridge you over to menopause. You have procedures like endometrial ablation, that's just burning the lining of the uterus. That is not a big surgery. It's an outpatient surgery that will treat your bleeding without even addressing the fibroids. But if the bulge in your belly is there, or if you're having painful, sex and other things that fibroids are doing, that are even outside of bleeding are happening, you should at least consider hysterectomy. Because the difference between the two things, myomectomy, it's a big surgery. Even though I do a small incision and do all those things that you see online, but it's still a big surgery. There's a risk of infection. There's a higher risk of bleeding or hemorrhage. There's a higher recovery rate. Like all of these things, that your post-operative pain, all of those things are higher, as opposed to a robotic hysterectomy, where I'm in there. You are going to leave out of the hospital in less than 23 hours and should be back to work in a week or less. Huge difference, and will never have bleeding, have pain, or anything associated with fibroids or your uterus ever again. Those are the differences. The only difference is that you don't have a uterus with one, you have a uterus with the other one. As long as that uterus is in your body, there's a potential for problems. That's a fact. Just is what it is. So that's my spill to that. It's not to say, hey, you need a hysterectomy, but analyzing what's really important to you, and then looking at the options and making a informed decision that makes sense for what you're going through and with your life. That's all I tell people to do.
No, I really appreciate that, because I hadn't looked at it like that. I had looked at it like I didn't want to do the hysterectomy because I felt like that takes away my hormones before it's time. And I felt like, I was going to have side effects like that. And then my mom went through a hysterectomy at Loyola,
Mm-hmm.
Probably about 15 years ago, and well, maybe longer than that. But
And it wasn't
she ended up
laparoscopic.
in the hospital for 5 days. She came
Mm-hmm.
home with a catheter. It was just and so I equate a hysterectomy with
bad things,
with bad.
and that is classic. Watch this.
Mm-hmm.
Hey, Cola, what is first of all, do you have any issues with dryness or any changes in your hormones, and why or why not?
I do not have any changes. I don't miss my period. I'm going on 3 years without it. It is amazing not to have a period, especially when you've had a lot of bad ones. And I kept my ovaries. So I only took out the uterus and my cervix. I didn't, so some people think hysterectomy means you have to get rid of your ovaries. Those are two totally separate procedures. Okay. So you just have to make sure your surgeon understands that and is not doing both.
Okay.
So with your post-operative pain, recovery, and all of those things, walk her through that. What your incisions look like. Tell her about that.
Right. So my incisions, and I may have a little bit more than some because, as Dr. Johnson mentioned, I was close to my diaphragm. So I was 32-week pregnancy stretched. So I have 5 little, they're not bigger than the tip of my fingernail. I have 5 little spots, and 1 low one because he had to use some space he had on the side to fit those ports in. But anyway, I have 5 little rings. If I wear high-waisted bathing suits, pants, whatever, I can show this part and nobody would ever see them. They're also not dark enough that if I put concealer on them, you would never know they were there. You would really have to be studying me to understand that.
Okay.
But the recovery was the only pain I had was tenderness where the incisions were, and it wasn't like I needed to pop pills all day long to deal with that pain. I'm a stomach sleeper, so I was taking medicine so I could sleep on my stomach. I should have
Don't
just
forget to
waited.
don't forget to tell her about your
Oh,
baby.
yeah. So
So
Dr. Johnson scraped me up too.
so like when you do the surgery, right? Like I have to like tilt you so that your head is here and your feet are up here. So it was extensive. Like she had 7 pounds of fibroid stuff, right? So Cola doesn't have a small derriere, so she started to slide on this styrofoam thing, and it made like little rug burns on her ass.
They weren't
So,
little. They weren't little. So I do have a battle scar. Now that's stayed. But even that, nobody knows that I have that scar. I mean, you have to really have on something skimpy to see that. But yes, I woke up and I was screaming at the nurse, "My ass is on fire!" And they didn't know why I was saying that. And they moved me and they said, "Oh, she's all scraped up."
Oh,
And they were like, "We got to put a gauze on that." I just they thought I was like probably still dreaming or whatever. But yeah, my butt did get scraped up. But again, that wasn't those were it was all worth it. It was all
okay.
worth it. I'm telling you, like I wear my battle scars as a badge of honor because to me it shows bravery that I went through this because
Yep.
I was terrified to have surgery. Like I won't even let the dentist take my wisdom teeth. Like every time I go for a cleaning, they like, you should take out your wisdom teeth. And I'll be like, nope, nope, nope. And I went through this interviewing doctors or whatever because that was another question somebody asked this month. Did I know Dr. Johnson before this? Absolutely not. We're friends now, but I
Yep.
interviewed him just like anybody else.
Mhm.
I chose him because out of the 3 people that I interviewed, he was the most thorough. He broke down stuff to like where I could understand it because,
Mhm.
obviously I didn't go to medical school. And he led with, I'm going to do what's easy for you. I mean, hard for me to make it easier for you.
Mhm.
So he was very thorough, like, and I'm going to be taking a chance, but I'm willing to do that because it'll be better for you in the long run.
Gotcha.
So and really, so everybody who's watching, new followers, whatever, we are friends now. I
yeah.
did not know this man.
She had the side eye the first time we met. She had the side eye like, what you know?
Yeah, so
How many how
I
many how
definitely
many of these you did before?
I stalked him on Instagram, like you said, for maybe a year first.
Yeah.
Um, and then he made this one video about why are you letting it grow the size of a studio apartment? And I really felt like that was talking
Yeah.
to me. And
Yeah.
I was just like, that's my sign, make an appointment because he's talking to me.
Yeah.
I
That.
remember that too.
Yeah. So that post made me say, oh, wait a minute, it's time. So but I have no regrets for having a hysterectomy, and because I'm many people's surgery sister now, or people DM me and tell me their stories, even people who have went through things before, a lot of women will say that they don't regret having a hysterectomy even if they've had 7 million complications after the fact.
Mhm.
They always say like it was actually the best thing I ever did, especially if their goal was they're not having any more children and they wanted to
Mhm.
be done with everything they were dealing with prior to the hysterectomy.
Okay.
So
I have one last question.
sure.
What's so for the recovery for either the myomectomy or the hysterectomy, like how long before you can start working out again?
So it's different. So with robotic hysterectomy, no heavy lifting, no straining, um, and no like ab work. At minimum a month.
Okay.
No sex for 6 weeks. But to that end, you can walk upstairs, walk downstairs. After a week, you can swim, you can ride ellipticals, you can do any of those things that you want to fairly, right away.
Okay.
It's really no wait time. For the myomectomy, it's a little bit longer. I mean, the biggest thing is clearly no pregnancies for 6 months, but Same thing. Just no super heavy lifting, no ab work. That's more so like I would say, 4 to 6 weeks, just depending on how you heal. But to that end, like walking upstairs, downstairs, and all other like aerobic stuff outside of lifting heavy or whatever, you could do that fairly quickly too. I would just say the difference between the two is that you probably won't feel like doing that as much with a myomectomy as quickly. It might take you, 2, 3 weeks before you feel like doing those things. Whereas with the robotic hysterectomy, you be ready to do those things within a week or so.
Okay. Well, thank you so much for letting me join and for the information. You gave
You're
me a lot.
welcome.
I really.
Welcome. Awesome. 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 It's a pleasure to meet you. We'll
All right.
talk.
Thank you.
All right.
Take care.
Thank
All right.
you.
Bye.
All
That
right.
was good.
That was definitely good.
That was a good one.
And yeah. Next question.
Yeah,
Oh,
there's more people in here, but we'll ask a couple more questions and then
okay.
we'll go over.
Sure. Are complex cysts considered cancerous?
They're not considered cancerous. They have a higher chance or higher likelihood of being cancerous, but that also you're looking at a multitude of other different things. There are other risk factors associated with that. Just an isolated ultrasound finding of like a complex cyst doesn't mean you have a cancer. You got to look at other different factors like family history, social history, smoker, any other history of cancers. There's a lot of other different questions that you have to ask. And then there are some lab tests that will kind of look closer and to see if that has a higher incidence of cancer or not. So yeah, it's yeah, don't take that isolated finding that's what we're talking about from an ultrasound as you have cancer. There's a full workup to find out the probability or the chances of a complex cyst being a cancer, but usually they're not.
All right. So the previous question that we was having issues understanding. So they are having a laparoscopic hysterectomy,
Hmm.
and the doctor wants to take everything. They want to keep their ovaries.
Keep them.
They are 62 years old. What is your opinion?
I mean, my personal opinion is 62 is probably not, because everything is risk versus benefit, right? So the younger you are, the benefit of your ovaries uh, and keeping your ovaries far outweigh the risk of removing them. So when you're too young, in your 40s, 30s, if you remove the ovaries, you actually decrease the life expectancy of someone. You increase their risk of heart disease, increase their risk of uh, osteoporosis or bone disease. Like those risks are real. They increase when you remove ovaries too young. But postmenopausal, which you're postmenopausal, there's not a lot of benefit, in the ovaries being there. Do they have any benefit? Yes, but there's also risk. The older you get, there's a increasing risk of ovarian cancer. Not to say that you just need to remove them for that. That's just like the older I get, I have an increased risk of colon cancer and other cancers. So I don't want to just take out my colon just because I'm getting older and there's a risk of it. However, if you're doing a surgery to remove your uterus and you have an opportunity to remove your ovaries as well, and you want to completely eliminate that risk of having possible ovarian cancer and for the rest of your life, then definitely an option without giving you the risk of bone disease, heart disease. You don't have those risks. So the benefit of them removing is not, it's well, I'm sorry. Let me not misspeak. The risk of removing them is not there. The benefit of not having to do an ultrasound when you're 75 and looking up and now there's a cyst on the ovary and now you got to do a workup and be scared to death that this is a cancer, you eliminate that if you remove the ovaries. But it's still an option. Nobody should push you to necessarily have to remove your ovaries. If you really, really want to remove your ovaries, to not remove your ovaries, then don't do it. But to that end, you got to be a person that just doesn't live with regrets either. If you turn 70, 75, 76, and there's a cyst or something on one of them, it's just what you got to deal with. That's life. too. So it's just all about how you look at it. But that's really how you make that decision. You know, you just look at everything as a risk versus benefit. When the risks are high and they outweigh the benefit, then you don't do it. But when the benefit outweighs the risk, then you go with the benefit.
And that's another that goes to a point of what I mean about when I was interviewing doctors. So the way you just broke that down, like sometimes a doctor will tell you, no, it's best I just take it all, but they won't explain why.
Hmm.
Like they're not, I know I'll be arguing with you about intermittent fasting, but I'm saying that it just makes more sense if you explain that to somebody so they can kind of
Hmm.
like understand, like, oh, this is why you recommended it. You're not just trying to
Right.
fight with me. You see what I'm saying? So
Absolutely.
a lot of
And
times I learned that even when I was looking for my surgeon, is like they won't, like nobody even told me what type of surgery. They just kept saying, "Oh, you definitely have to have surgery." You definitely was like, "You're gonna have surgery. We're gonna start with laparoscopic, and hopefully I won't have to convert you." And blah 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 blah. Like
right.
nobody was doing all of that. They were
Yeah.
just gonna get in there and do what they wanted to do.
Yeah. And to that point, like I can't quick talk people. I can't microwave people. These conversations that I have right now is the same conversations I have every day in virtual consultations and in-person consultations. I cannot, it's one of my pet peeves, one of the things that I can't do to have somebody sitting there in front of me just bewildered and still having questions and be like, oh, gotta go. I gotta go to the next patient or whatever. I have to make sure that this person in front of me, even if they got a trillion questions, I have to make sure that they are comfortable and all their questions are answered. It's just something inside of me that has to do that. Now that makes other people upset because, oh, what about my time? What about my time? And it's like that bothers me too, because like if you look at like just your time, I'm never selfish with my time with people. I'm always giving with my time with people. So I expect people to be giving and caring and compassionate to other people's time. So if I'm late to see you or late to talk, like like I was literally talking to somebody else that was scared or nervous that needed extra 15, extra 20, extra 30 minutes, however long they needed for me to sit up there and talk to them. So just be very cognizant that this doctor's office is not Burger King. I've had patients that have like stormed out or like got mad, put complaints in there or what have you. If that's the case, if you are on a strict time constraint and you need to like do like this, like I am not the doctor for you. That is the quickest way to upset me, is to do that, because I'm not that way with anybody. Like if I go in there with surgery, I'm in there. Like legit, this girl last week had, I ain't even counted all because I'm at another hospital, but it was well over 100 fibroids, well over, and I lost a ton of blood. But I was sitting in there picking out every one of them damn fibroids. Took me over 6.5 hours to do that, but I could have at 4 hours been like, you know what, this is good enough. But I'm not gonna do that because she doesn't deserve that. I promised her that I'm gonna do this. I'm committed to doing that, and no matter how long it takes me, if I don't feel like it, I'm gonna do that. But that's the type of, compassion that I expect everybody to have for each other. It's not just me having it for people. Like we gotta have that for each other too. And just kind of look out for each other. Because the same people that be complaining about time, them be the same damn people with a trillion damn questions. And they're like, you mad that I'm coming in talking to you, but you're gonna ask me 4 trillion damn questions, and you're not caring about the next person, but you mad because I'm in here. Let me get off this soapbox for you. Get me all riled up. You pissing me off.
I didn't, I didn't say it.
That'd be pissing me off, man. That'd be like, I mean, that's the quickest way to piss me off. Is like, I've been in here three. Like, I'm not for you. I promise I'm not. But don't do that.
All right, you can let the next person in, and then I'll go
All
to the
right, let me see.
back and forth.
Let me see. Do 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 do. I don't know if you popping in or not. There you go. Hello.
Oh
Oh
wow!
wow,
Hey
you on
y'all.
here? Look like you underground somewhere. Where you at? You
Hey, can
downtown?
you
Where
hear
you?
me?
Yeah,
Yep.
we can hear you.
Okay, hold on. Let me get to a better place because I'm actually at work right now. Yeah, I'm on a night shift. Okay, so
On the
we had
night
talked
shift.
before.
Yeah,
Yeah.
I remember. I remember.
Yeah. And I wasn't trying to boss hog and get on here again because I know other people need to be seen or whatnot.
It's okay.
I I actually ended up canceling my procedure. I went ahead and canceled that, and I would like
Hmm.
to get everything started to make preparations to see you because yes, I still want to have a baby, and that is
Okay.
what it is.
Okay.
The women in my family have had kids 45, 46, 47. So we're very fertile women. It just happened that I was the one that ended up with all these fibroids, and plus they've had fibroids also during their pregnancies, um, where some of them ended up having to go back after the baby was born to have them removed. So um, I'm ready. When I did give a call to your office, the lady was saying that I needed to get a referral. Now, the type of insurance
Where
I
where
have,
where 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 you
I'm in
located?
Columbus, Georgia.
Got you.
It's,
So to that end, so I will say this because you said a couple of different things, and I'm listening to you. And this is for everybody out there that's listening. Be careful about comparing yourself to anybody in your family, any of your friends. Everybody's different, right? I have women right now that have, that come from multi, yeah, their mom that had 7, 8, 9 kids and having trouble getting pregnant. I have women that have the worst fibroids on the planet and don't have, and nobody else has like significant fibroids like that or whatever. So every body is very unique. You can't really you can't really predict what your experience or what your body or what's happening with you with your family. So I would be careful with that. So to that end, it's really simple. This information is very easy to find out. You can find out what your air quality looks like, right? That's a very easy thing to do to find out how your air quality is looking like. So before you go into any decision about fibroids or your uterus or preserving or what have you, find out. That test is called AMH or anti-Malarian hormone test. It's a blood test, and you could literally say exactly where you're at. And if that number is super low, it doesn't matter that Auntie and them had kids at 47. If your AMH is point 0.1, you not Auntie and them. So you have to plan
okay.
like for your specific situation. And I'm not saying that you're not or what have you, but it's planning, right? When you
Mm-hmm.
go to work and you ready to buy a car, you ready to buy a house, you plan your finances, you plan your
I
fun, you
sure
plan
do.
your life, how many hours you got to work, how many, like, you plan all of that stuff, right?
I sure
Every
do.
situ every situation in life,
I,
you plan and make it happen. Now, all your goals and things, you're planning for your goals.
yeah.
So there's no way on God's green earth where you are planning to have a baby, which is probably the most important decision of your life. You be like, I ain't gonna plan whatever God do. If I have it, He blessed me with this man, and it just happened. And Auntie and them had. There's no planning in that. You
Right.
have to be very, very steadfast and diligent and doing your homework and planning that. Because
Right.
if I could do your surgery tomorrow, if I could do your surgery tomorrow, it's literally 2025 summer before you can even attempt to get pregnant. That's a
Correct.
fact. That's
Right.
a fact. And if your AMH right now is point 0.2, the chances of me doing this fibroid surgery and then you going to summer 2025 having a unprotected sex and trying to get pregnant now with this new uterus is a better chance of me going and getting selected for the Olympic team and playing for USA basketball. It's a fact,
Right.
right? But and that's not even being funny. That's just saying,
I
look,
know.
these are the chances that you have, and if your chances are low, you have to be very intentional with what you're trying to do. So if let's say, for instance, your AMH is point 0.2, point 0.3, point 0.4, The conversation isn't to have this fibroid surgery. The conversation is to go freeze some eggs, go get some eggs right now, like yesterday, and get them out so that we can deal with your fibroids and you have even an opportunity to get an embryo and put it into your womb after it's been repaired. But it's just steps, it's just priorities of your steps and organizing the things that you need to do to accomplish your goal. But I'm more than happy to help you. But as far as like my office and stuff is concerned, like anybody that's like out of town or
Yeah.
go ahead, I'm sorry.
Yeah. You say anybody that's out of
So
town?
as far yeah, so so these things that I do like with through social media or whatever, it is like completely me. It is has nothing to do with my office, whatever. I offer just a service to be able to virtually consult with people or what have you, just because that's what I want. I don't want to be confined to Chicago and just helping the women in Chicago. So I do these social media things or what have you, so I can help people in Columbus, Ohio, LA, Miami, Finland, Canada. Like I offer that for you guys to do. So calling my office, they're not dealing with any of that. Like if you go to my office, it's literally you got to drive there and come in to come see me. That's the only thing that they dealing with. If you're doing a virtual consultation, it's all through the website. It's all like just outside of that.
Gotcha. Yeah, that's exactly how it was with the UFE, because just 100 miles from where I am, I can be in Atlanta. And I just want to say thank you guys because I answered that. And I'm just ready to move forward with this.
You're welcome.
But
They got a hot special going down in Atlanta because you like the third person in the past 2 weeks that said they was going to drive to Atlanta to get a UFE.
yeah. Oh, it's hot down there. Hot
Yeah,
Atlanta
here.
for real.
Hot Atlanta. The high UFE Atlanta.
Yeah.
Huh? I get it.
Well,
Yeah.
Dr. P and I can never Corla Bell.
Color red.
Color red. Yeah. Listen, you guys are very comforting, because the thing about it, if I do go in and get my numbers and see where I stand, it's always good to hear Cola Red Bell give her standpoint on if a hysterectomy is the option afterwards. I mean, you've been very positive and very giving optimism to women. I appreciate both of you. Dr. P, I pray I see you soon.
I'm here.
I thank God for what it is that you're doing. And
Appreciate it.
Thank you.
Man, y'all are blessed. I just pray blessings upon y'all all the time. And I do hope to see y'all soon.
Thank you.
Yeah.
Thank you. Awesome. Let me know how I can help.
Make sure I give you all my numbers.
Give me the update.
Okay, I will.
Don't work too hard on that night shift.
Oh, I'm not. I'm good. I'm here by myself. Ain't nobody bothering me.
That's good.
All right.
Payroll pimping.
How you get off of this?
He'll let you out. All right, you got another one?
Yeah, it's one more.
Okay, I'll do that one first, and then
right.
we'll
and
be
then
at
we do the last couple. Yeah, so we do the last couple questions, and then we're done.
See how quick we came back, y'all? 2 weeks.
2. Yeah, that was pretty good. I don't even know if she's still on there. Accept it. I tried. That's all right. We can go to the question. Oh no, there she go.
You don't see.
Hello. Hi.
Hello.
We can't see
Hi,
you
I
either.
can't see you. I can see Color Red.
Yeah, we can't see you.
I don't know how this works.
We see everybody.
How?
Everybody see your black screen, but we
I
my
I see Color Red, but I see everything is black.
Yeah, do you have an arrow thing to like flip your screen over?
There you go.
There you
Just
go.
a minute.
Look at God.
That's it.
Good.
We're
Okay,
doing
I
Good.
can
How are
great.
see
you?
Cola Red. I can't see Dr. P, but how y'all doing?
Awesome.
I'm doing good. Thank you for asking. But you answered most of my questions. Sorry I couldn't get everything into the box the way I wanted to because it
Okay.
wouldn't allow me
Oh,
to put so many words in there, characters. But you answered most of my questions for me about the ovaries and stuff like that. But I had another question. Cola Red was saying something about some of the people were satisfied with the decision of the hysterectomy, but even though they had complications. So what would be the complications of the surgery after the hysterectomy
oh,
at
so
my
what I was
age?
referring to was people having their own situation. So it wasn't like an age group. It wasn't like a specific, like there was one lady that shared with me that she had she had uh repeated issues with pain. She had repeated issues with her scar like not sealing properly, like whatever incision she had, I guess it was coming apart.
That was me.
Even stick.
That was not
No,
for
it
me.
was. These weren't
Oh,
your
oh,
patients.
okay. I'm about to
People
say, I
shared
ain't
with
tell me
me.
something.
No, 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 not you. He
uh,
like, wait a minute. No, no,
right.
no, no. These were somebody shared with me that they had an issue with their incision wouldn't stay closed, but they weren't Dr. P's patients. It's just now that I share my story, sometimes women inbox me and say, "You're so brave. This is what I went through before I even knew you or Dr. P, or I wish I would have had a doctor like that." But I'm still feel like I made the best decision because they went through so much. So it wasn't just an age group thing and it wasn't a
Okay.
specific complication. It was like I had about 3 or 4 different women share that they had some complications afterwards with different providers. And not necessarily, and all of them weren't related
Okay.
to actual surgery. They may have found
Okay.
out they had something else going on, like Dr. Johnson was just explaining tonight. Sometimes it's not even the fibroids that is your full issue. So they even found out they had other issues that they had never addressed.
Okay. Okay. And my thing is, and it's a mental thing with me because the way my mind works is that where does everything go when you take everything out? I mean, because right now I don't counsel like 2 surgeries because of that, and I have one's going to be coming up Tuesday, and I counsel that because it's my mental that's thinking about where everything is going and how I'm going to feel afterwards. So I think that's my biggest question right there, as far as I'm mentally prepared to do it. I'm mentally prepared to go through everything, but it's the after as far as my mental. So where does everything go at after the surgery is over with? Because I did research on what they said, everything comes together a certain way or whatever. But my whole thing is, where does everything go? My doctor's not explaining anything to me. And I've done research on other doctors, and
So when you
one of
say
the groups
where's
I am on
everything going,
Facebook
like, can you be
refer me
like a
to
little bit
Dr.
more
P.
specific? Like, what specifically? You mean like where does it go after it's out, and what do we do with it, or like what's happening in your body?
No, 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 no. Oh, okay. So if he's taking out my uterus and my cervix, because I heard Cola said that, and that's the only thing because I was adamant about my cervix. But listen to her story. Me and her talked a lot into the messages, and the cervix I can somewhat see that and can be comfortable with that. The fallopian tubes, probably that too, but not my ovaries. But after everything is coming out, the cervix, the uterus, the
Okay.
fallopian tubes, where does everything else inside your body go? That's it's to me in my mind because it's a mental thing for me, and I visualize a lot of stuff and analyze a lot of stuff. It's like I'm gonna have a hole in my body,
I
and
hear
that's
you.
something that I'm gonna have to be sitting there thinking
Hold
about
on a
all the
second. Let me.
time. You know what I'm saying?
So
So where does everything go?
when you look at a picture, right? Like you look at this like real time
Mm-hmm.
and kind of like say, hey, this is what's in my body. This is just like a picture, right? This is not really what actually happens. So for your ovaries, the things that you don't see is like, yeah, there are these little ligaments in which the ovaries are connected to the uterus, but there's a huge suspensory ligament that comes down from the main, well, it has like the blood vessel to the ovaries, like the ovarian artery, ovarian vein, it has this huge ligament called the infundibulopelvic ligament that is connected to this side of the ovary. And once you disconnect the ovary here, it's literally still connected to this big stalk of a ligament that has the artery and the vein is there. That's what it's connected to. So it's not just dangling or go down to the bottom. Like it's literally connected to the ligament on both sides. Like both sides have a ligament, so that's how they are. As far as like once
Okay.
the fallopian tubes and the uterus and the cervix was removed, like the only thing that you feel in at the top of your vagina is literally that cervix that's connected to the vagina. Once this is detached from there, it's literally just closed. That space or that defect is closed. So there's no change in your vagina, really. It's just
Mhm.
instead of that knob is there, now that knob is there, and then that spatial defect is closed. As far as everything else is in your body, like you have like I don't even know how many feet, like 30, 40, 50 feet of bow that's just like coiled around all into your belly, right? And so this uterus, no matter how big it is, pales in comparison to the total volume or the total size of your actual bowel. So when this little thing is removed out, this whole coil of 30, 40 feet of bowel, it just literally just falls in place and it just fills in that space that the uterus, it has no change on that bowel. It's almost like, let me give you, I'm always about examples, right? It's almost like, um, if you have like your hose outside, like your hose where you water your grass and stuff that's hooked up to the thing, and like you wrap it up and you like have it on like a little thing where you hook it up and you wrap it up. If you take that little thing off, the hose is just gonna still be there. It's just gonna find a new place just to be. It's not like it's gonna like fall through your vagina or go anywhere. It just finds a new space to be at. So the uterus is not there. It just forms where the uterus was at. But it's so much of it that there's really no change. And that's really all you're left with is you're left with your bowel, which forms into place of where your uterus left off. And then you have your ovaries, which are connected to their major blood supply, and they're suspended right there from the infundibulopelvic ligament. Everything else is just there's nothing else to really depend on. And as far as like the other common like myth is that once you remove the cervix, then the vagina just falls down or the vagina just like collapses. That's not true. So and this
Yeah.
has been studied
Mhm.
over years and years and years, whereas like they looked at women that have had hysterectomies where they've kept their cervix, and they've looked at women that have had hysterectomies that have not kept their cervix, and then
Mhm.
they also looked at women that had their uterus and their cervix or whatever, and then looked at the percentage and the ratio of who had vaginal prolapse, who had like compromised vaginal tissue, and it's no difference. There's absolutely no difference. So removing that cervix, whether you keep it or not, doesn't change if you're going to have vaginal prolapse or not. Because if you're going to have vaginal prolapse, it's going to happen whether that cervix, uterus is there or not there. Because at the top of your vagina, the thing that you don't see and that we don't talk about is there are ligaments that suspend the top of your vagina too. Uterosacral ligament, sacrospinous ligament. So there are ligaments that are there that kind of suspend the top of the vagina. So even when the cervix and the uterus is gone, those ligaments are still intact and you sew that hole up at the top of your vagina. There's not falling down unless you have some of the risk factors in which that can happen over time, which smoking, chronic lifting, genetics, obesity, like there are a bunch of risk factors that contribute to like the vagina falling or pelvic organ prolapse or vaginal prolapse. There are multitudes of risk factors. None of those risk factors have to do with whether you've had a hysterectomy or whether you've had your cervix removed. None of them do. All right. Does that help?
Okay.
Okay.
Yeah. Yeah. It helps a lot. So the last question is because I canceled two and now thinking about canceling Tuesday. So how long do you think I
I
should go before
understand.
I it's nerves with me. My brain is like, but I went through the pre-op, and that was like
Sure.
I don't know, that was the worst thing for me. My nerves and everything else was shot just going through the pre-op. So how long do you think I should go before I have the
I mean, I
surgery?
don't
I
I
know I'm
don't
not
know
supposed to go
your
that long,
story
but
in
I'm just
particular or
asking.
what's happening in particular, but if there is like, major issues that you're having because of fibroids, because of your uterus, then you should, it may be something you need. But if not, it's not necessarily something that you have to have. Do you have major fibroids or like what's really happening?
Okay, so I've been dealing with this now for 5 years, and my ex PCP, I got rid of her for one reason because it took her 2 years. Well, it didn't take her 2 years. 2 years, she didn't tell me about the fibroids. She didn't even tell me I had fibroids, and my ex GYN didn't tell me. What they did was like kind of just went over it. You just have bleeding. I'm asking where it's coming from. Nobody answered me. They did the regular tests as far as that you take for endometriosis and all the rest of the stuff. Okay, so I'm going back and forth, back and forth. I'm an assistant teacher in the school for special needs in elementary. So it was embarrassment for me to be in front of the students, and I'm constantly trying to fly to the bathroom to keep from bleeding out. I hemorrhaged before. I was back and forth into the
Hmm.
emergency room. All they did was pull the clots out. Clots was about as big as my fist. The last time that I got tired of going through everything was last year in January. And I sat on my toilet for 2 days straight. Couldn't get up, couldn't do anything. Couldn't eat. So the third day, I just took my chance to say, okay, fine, I'll go to another emergency room. And I went to that emergency room, and that's when I found out about the fibroids. That's when I found out it was medicine to take to stop the bleeding. And so he talked to my doctor, and that's when I think I kind of got rid of her. I went to Chesapeake to a women's health department, and she was going to do the UFE thing, and I think that's during the time that me and you were talking in the messages, and I didn't do that. So I came back over here, and they got upset because I didn't do it. So when I came back over here to the doctor I'm still with now,
Yep.
I told him my thing was relationship, getting to know him getting to know me. I went through the flirtation thing. I went through, arguments and debating about certain things to the point that I guess now he understands where I'm coming from. So he started giving me the medicine for the Provera because my GYN I had before refused to give me anything for the bleeding. Like she said, I'm not giving you anything. I'm not doing this. I'm not doing that. So that left me, thinking, okay, fine. What's going to happen to me? What's going to, the bleeding was. I don't have the pain. I don't have no. Some of the stuff I hear women say they have. It's just like I'm having a regular lady day, but it's just excessive with the bleeding that lasts for about 2 weeks at a time. Um, and it's just, the most thing I think I don't like is the clotting. And because when it comes out, that's the only thing that kind of hurt when it comes out of me, and
Got you.
just I can be walking and
Um,
it just goes.
so
Mm-hmm.
to that end, I agree with you that like relationships are extremely important. You need to be 1000% comfortable with your surgeon and what the things that you're being told, and also you need to have all of your options, not just the options that people feel are right for you, but every option that you can have, so that you can make an informed decision. I think that that's very important. If you don't mind me asking, like, how old are you? Can you tell me that? You're 62, and you're still having
62.
menstrual bleeding?
No, no, no. I'm not having menstrual bleeding. I said something like having my lady day. Okay, I was referring that to the bleeding that's coming out. It's something like your lady day when you have your lady day monthly, but it will be excessive, like 10 times excessive. So the last time that I had an episode was
So with that,
March,
with that,
April, May. Was it May? May, June. The last time I had an episode, that lasted for like about a week and a half, but it was
did
like a
they
lot of
talk? Did
bleeding
they
and it was
did
a
they
lot of clotting.
did they talk
So
to did they
um,
talk to you about
out of the five
endometrial
years I've been
biopsy or
dealing with it,
endometrial sampling?
mhm,
Okay. All right.
yeah, we
So
did
that's
all
what
that.
they got to rule out.
Everything was
So just for
came out
everybody
fine.
that's listening, once you go through menopause, you should not have bleeding anymore, right? So if you do have bleeding, that's an indicator or a sign that something could be wrong. And so you don't want to sit on that. So if you're having that, your doctor should be giving you,
Hmm.
some offering you endometrial biopsy or even a DNC, if the ultrasound shows that that lining is still thick to make sure that there's not a cancer that's making you bleed or there's anything else other than something normal that's causing you to bleed like that. So I commend them for doing that. So I'm glad that your endometrial biopsy and
Right.
all that stuff was normal. But now it's to the not now it's to the point where you got to look at your other options. I
Mm-hmm.
don't know what your fibroids really look like, but there are other options like endometrial ablation. There are other things that could be done if this is just run of the mill bleeding or bleeding issues that you had that you can use to control that. If you don't have fibroids that are pushing into the cavity of your uterus, you can always do an endometrial ablation. That's another option. That's another option for you.
Mm-hmm.
It should.
So
It
that would
should.
stop
Well,
the
the
bleeding
fibroids are going to be
altogether,
there. It's not
and the
addressing fibroids
fibroids.
because it's very unlikely that these fibroids are causing you to have the bleeding. It just that they're there. Two things are happening at the same time. You got postmenopausal bleeding, and then the other ones you have fibroids.
Mm-hmm.
These could be very mutually exclusive and not have anything to do with each other. So trying to treat your fibroids or do something to your fibroids is not going to change whatever's happening as far as your bleeding is concerned. But there are, if you're
Okay.
not concerned with actually doing anything with your fibroids, which if they're not bothering you, you don't necessarily need to, and you're looking for options just to treat the bleeding, then the endometrial ablation has to be put on the table because the endometrial ablation will at least burn the lining of the uterus. It's an outpatient procedure, takes 15 minutes. You're out of the hospital the same day, no recovery at the end of that, and that should be the end of your bleeding issues after that, but that's just another option.
Okay. So I think out of all the fibroids I have, the biggest one I have is 10 centimeters. I think you said 10
Okay.
centimeters. I got some that's 7 centimeters, 5 centimeters, 2 and 3. Altogether, what I see on my MRI and the report, maybe something like
Hmm.
10
Yeah,
or
you
12,
probably got
something
about,
like fibroids I have. I'm not really sure. I'm
yeah,
not going to go by the count, but that's from what I read off
yeah, the
my
count
report.
is not
Because
as
I
much
always ask them for my report
as
in the
the
CD.
symptoms and like where you feel it at on your belly. If you feel them and they're past your belly button and they're really bothering you, then yeah, you may want to do something about it. Um, but if they're not, if they're smaller, 10 centimeters is not super small. 10
Right.
centimeters is about like that. And that's, that's that.
Oh,
I don't
she
know if you
can't
can
see
see.
you. So he
So
I
going
so if
can't
you
next.
see.
yeah, so if you put your middle finger to middle finger, thumb to thumb, that
Okay.
space in between there is about 10 centimeters. So that's like your largest fibroid, and with that is sizable.
Okay.
So if you wanted to remove, yeah, I would recommend just removing that. I would
Mhm.
definitely recommend hysterectomy if you wanted to do something definitive. Um, but to that, that's optional. If we're
Right.
just straight talking about bleeding, you could do something like an ablation. If we want to eliminate everything,
Mm-hmm.
fibroids, bleeding, and everything else, then hysterectomy makes total sense, and laparoscopic or robotic hysterectomy makes the most sense.
Okay, good. Because when I asked them, when the other doctor from another emergency room found out, he was concerned about the same thing you were saying about the bleeding, where the bleeding coming from. I went to Richmond, Virginia. I'm in Virginia, and he said the same thing. They should be doing an MRI study, and nobody wanted to do that. So I had to kind of be persistent and advocate for myself in order for them to do that. And then when they did do it, they wouldn't read me the report, or they wouldn't explain it to me, what was on the report, what was on the CD, what was the MRI was about. So what I did, I took it upon myself to come home and,
Sure,
look it up on
sure.
YouTube and, educate myself about it.
Yeah, so you got a lot to think about, and like to your point, you got to feel comfortable. You got to feel comfortable with your own
Yeah,
thoughts, and you definitely got to feel comfortable with whoever is doing your surgery. And if fibroids are a major issue for you, and
right.
they're really impacting your quality of life, and you're having issues with them, then yeah, you should definitely deal with them. Does that help?
Okay.
Okay, awesome.
Okay. Well, thank you both. No, that helps a lot. I mean,
Awesome.
you just don't know. That helps a
Happy to
lot and puts
hear.
me my
Thank
mind
you
at
for
ease for a
I'm
lot of
glad you were
things.
able to
appreciate it.
join
Yeah.
because I know we talk
Awesome.
a lot. So I'm glad
You
you were
too.
able
Oh,
to
well,
join.
thank you so
All
much.
You
right.
too.
And y'all
All
have
Hope
a
it
right.
good
helps.
weekend.
All right, my dear.
Yeah, thank you.
All right.
Well, all right.
So we at over an hour.
Yeah, that concludes the proceedings this evening. What, unless it's like something else
Well,
pressing
no,
in here
no,
that
I
I need
got
to
one
answer.
that's submitted,
All
and
right.
I want you to go over this because somebody unfollowed me because I told them full hysterectomy, I mean partial hysterectomy and full is bad terminology because we didn't went over this a lot. But they got
Yeah.
mad at me. So could you please explain this so people don't think I'm making this stuff up?
I mean, terminology is terminology. Like people get mad. I don't know why people would get mad at like education. Like I don't know everything. It's a lot of stuff that I don't know. I just know this one particular thing and an expert at that. But um, it's just educate. If they get mad about education, and so be it. But
I said
so
it
the
very
term,
nicely too. I wasn't being an asshole.
yeah, I get it. I be hearing that too. So complete and partial hysterectomies are really bad terms, right? They they were intended to basically imply if a person is having their ovaries removed, which would be a complete hysterectomy, versus not having your ovary removed, which is a partial hysterectomy. This is not accurate terminology. So the term hyster means uterus. The term the that's the prefix. The suffix of ectomy means removal. So whenever you hear a prefix, whether it be hyster, uh, um, cholecyst, cholecyst is gallbladder, append is appendix, spleen is your spleen. When you hear those prefixes, if ectomy comes behind them, it just literally means removal of whatever it is you just said. So a hysterectomy means removal of the uterus. Cholecystectomy means removal of the gallbladder. Oophorectomy means removal of your ovary. Salpingectomy means removal of your fallopian tube. Thyroidectomy means removal of your thyroid, right? So just getting the understanding. Ectomy is just after whatever it is you're talking about and to remove it. Hysterectomy means removal of your uterus. So when you talk about hysterectomy, you can say complete. I mean, excuse me, not complete. No, scratch that. You say total versus subtotal, right? So a total hysterectomy means to remove everything. So remove your uterus and your cervix. When I say a total hysterectomy, I mean removing the uterus and the cervix. When I say a subtotal hysterectomy, that means removal of the uterus, but keeping the cervix, right? It's very rare that I will remove the uterus, but keep the cervix. It's very few instances. I had one woman that wanted her cervix, kept it. But there's physiologically there's absolutely no need for your cervix to exist without your uterus. If you have your uterus removed physiologically, your cervix just being there is either A, because you really want it there, or B, the only other time that I would do it is when I do like suspension procedures. Like if somebody did have vaginal prolapse or whatever, I can use the cervix, do a hysterectomy, remove the uterus, keep the cervix, and then use the cervix to uh, um, tack material on it to pull up the vagina from the inside, right? That would be the only other time that I would remove the cervix. Other than that, hysterectomy, total hysterectomy means just removal of your uterus and your cervix. Your ovaries is a totally different part of it. Like so, removing your ovaries, your fallopian tubes is a different part of the surgery. It could be the same surgery, but it's just a different aspect of that surgery. So when I perform hysterectomies, it's a hysterectomy hysterectomy or total hysterectomy with bilateral, meaning both sides, salpingectomy, meaning removal of the tubes, or it may be a total hysterectomy with bilateral salpingo-oophorectomy, and that means removing the uterus, the cervix, the fallopian tubes, which is the salpingectomy, and the oophorectomy means the ovaries. So just depending on whatever it is I'm removing, it has to have the name of it plus ectomy behind it. Hysterectomy, salpingectomy, oophorectomy, those are different parts that can be done at the same time. But when you talk about hysterectomy, just straight hysterectomy, we're talking about removing the uterus. If you say a total hysterectomy, removing the entire thing, the uterus and the cervix. Subtotal, just removing just the uterus. It has absolutely nothing to do. So even if you do partial, complete, or what have you, you can use those terms the same way you use total and subtotal, but it should never mean keeping your ovaries or not. It should only mean what you're doing to the uterus. That's my problem with saying partial versus complete, is that we've automatically related it to whether or not you take your ovaries or not, which is wrong. It should not be that way. I hope that
Yeah,
helps and that breaks it down.
it definitely does. All right. So I want to say thank you for joining us tonight. And we will try not to be so long when we do the next one. And he will save this on his page. I also record it and put it on YouTube if you need to share with someone that does not have social media and cannot watch it on Instagram, because like he just said, we definitely like to educate, and it's never to teach you that you're wrong. It's just to get education, so when you're talking, you can advocate for yourself for the best care.
Absolutely. Absolutely. So thank you guys.
Yes, we appreciate
Appreciate
all
it.
of you.
Oh yeah, somebody share your little 7 pounds this week, Cola.
Was that the Monday patient or
Two
oh
Tuesday,
Tuesday?
15 pounds robotic.
Okay,
15,
the lady from Tennessee.
15 pounds. Nah, she
Oh,
from here. She
okay.
local.
Oh, okay. She
She
local.
local. I was shocked. She local. 15 pounds
Wow.
robotic. I even
I,
shocked me.
I told you that once. Well, you told me kinda too,
Yeah.
but once I told you it was definitely gonna people that just needed to know they weren't by themselves and they was gonna
Hmm.
shatter me. Cause I'm
Man.
telling you, I was watching your videos like he don't even know me and he judging me. So
Yeah.
that's why. So I was like, and then when you said, well, you want, since you found me on social media, you want to share this, and I said, ain't nobody gonna care about my story.
Oh, they
When was I
care.
wrong?
I
I was
told you.
completely wrong.
I
Like people
told
was
you.
like, "Oh my goodness, I know exactly. Oh my good, that's all I." And they was brave. And people said, "I don't even deal with fibroids, but now I'm making my health a priority." And that's the biggest blessing I could
So,
ever ask for. That it
absolutely.
it encouraged people to do something, even if it wasn't fibroids. And I love
Absolutely.
that. Yeah.
Absolutely. Doing great things. I told you was gonna change people's lives. I told you.
Yeah, you did.
Yeah.
I was so scared about my own situation, though I couldn't see
Yeah.
the vision. But you was
She
absolutely.
didn't want to get on here. She's like, oh, I don't want. I was like, man, get on here and talk about this stuff.
Yeah, I was like, nah, nobody really cares. I was, again, we always say, I was ashamed that I had like not done anything for so long. So I actually was like, I don't want to talk about it because they gonna be like the things you say, like, what, well, why you wait so long? What took you so
That's
long?
crazy.
Like,
That
you
bothers me.
do feel shame because people say those things, and
Yeah.
it truly, I mean, it's a fear for a lot of different reasons,
Yeah.
you know. And
Yeah.
like I said, I still had to interview people. So it wasn't like the first person who said they was gonna do it, I wasn't cool with.
Right.
Like, just I really wanted to make sure if I do this, it gotta be right.
And y'all stop doing that, man. Like, why they wait so long or why they do this or whatever. Like, y'all don't understand, man. Like, not everybody. Some of y'all are compassionate, but other people are just really not compassionate. It's like, yo, if somebody tell you they're gonna cut you from your privates to your chest, you know, and that's the only option you have, like, that's not like, who wants to do that? You know what I mean? Like, that's just a lot for somebody to have to go into or whatever, and people will run from that. I will run from that. If you told me you was gonna change my life and cut me all the way up in the middle of me like a fish, like I would have a problem
Mhm.
with that. I will run and I will continue to run until I find someone that is not going to do that, that's going to care enough to not make me go through that type of pain and that type of like torment. Your life is never the same when you do that, you know. So you really have to like keep it in that lens. Like the only difference between Cola and one of you guys with small fibroids is just hers just grew to a bigger size, but you just some growth away from that. Like it, and we don't know why they grow that way. We don't know
Mhm.
like who's gonna have this problem where they grow to this abnormal size and not, and that doesn't make you any better than the person who that grew like that. It just makes you different. So do not judge women like that. Like it's I deal with women that are extremely vulnerable, extremely scared, have really listened to, you know, 6, 7, 8, 9, sometimes 10 doctors that have told them they are going to cut them from their privates to their chest to do something, and they're scared. They are legit shaking nervous about the words that are about to come out of my mouth because they feel that I'm going to tell them the exact same thing and there's no hope.
Mhm.
And until you're in that type of situation, until you have that type of feeling of like helplessness and just like doom and gloom, stop judging people. It is like horrific what these women are going through, and that people are judging them. It's whack, man. Y'all, I'm advocating for them. I take the brunt of it. People like he don't know about women, whatever. Y'all want to treat me like somebody white talking about black women, black people issues. That's how y'all want to do me. That's fine. I don't care. But I advocate for women because like I hear you. You know, I see what's happening. There are not a lot of good surgeons out here. There are a lot of people doing some quack stuff to people, and it's making people scared, and rightfully so. They should be scared. And so that's where I come in to really try to alleviate that. But us as a community, as a people, we need to be way more supportive of each other, and more compassionate for each other or whatever, because you don't know what those words that you say, how that impacts someone's life. You don't know how asking somebody that has like a 30 centimeter fibroid when they do, or how far along are you, how that mentally impacts her, how you just destroyed how she feels about herself and how she treats her family for the next month. You have absolutely no idea what you just did,
Yep.
you know. So my job is to tell you what you did and to stop, because you're hurting people. It really, really hurts women when you do that. It hurts their mentality, and it hurts how they are able to take care of their families and how they're able to take care of themselves and their mentality. It really, really hurts them. So that's it.
And
That's my
sometimes,
soapbox.
no, you're right. And then sometimes, like the lady that joined early, and I'm gonna leave on this point. She was saying like, well, my family did this. My family, I didn't have anybody in my family that had fibroids like me, so I felt alone with that anyway. So I didn't have anybody in my family that I could say, what did you do when you dealt with this, or what did I don't have anybody that had that. Like I'm the first person, you
Yeah,
know, to go through that much growth with a fibroid. Like I definitely have relatives that have them, but they're not an issue. They don't cause any symptoms, but you know, but I don't have anybody that had to treat advanced fibroid disease. Nobody close.
yeah,
So
yeah.
you feel alone anyway,
Yeah.
and then you feel like somebody's gonna say, well, what took you so long, or why you let it get like that, or whatever. So
Hmm.
it's a lot. But I'm glad I shared, and I'm glad that
I'm glad you
um,
did too.
you told me what this could evolve to, because like I said, 3 years later, like I always tell people, we friends now, but I did this just like anybody else. I came fresh off the boat to this world. Yep.
Yeah, absolutely. Absolutely. All right, so I guess we'll do it again in another, well, maybe 2 weeks or so.
Yeah, we'll definitely.
Um,
I'll send you my schedule and stuff, and
yeah,
we'll make sure Ariel get us on the books.
for sure. Sounds like a plan.
Thank you
Everybody,
for
God,
tuning in, everyone, and we will talk to you all soon.
absolutely. God
Have a
bless
good
you
one.
guys. All
Bye
right.
bye.